Hi, I'm Dr. Behnaz, pelvic floor specialist. Today, let's talk about something so many people deal with but rarely discuss openly: constipation and pelvic pain. Why constipation causes pelvic pain? Constipation isn't just about going less often, it's about hard stool, straining, and that constant feeling of incomplete emptying. Every time you strain, your pelvic floor muscles contract and brace. Over time, this guarding turns into pelvic pain. This is why constipation is one of the most common causes of chronic pelvic pain. It doesn't just affect the gut, it keeps the pelvic floor locked in tension, creating pain with bowel movements, sitting, and intimacy. I often hear patients say, "It feels like I'm fighting my own body every time I try to go." Symptoms you might experience: painful or incomplete bowel movements, a heavy dragging sensation in the pelvis, straining or pushing hard on the toilet, bloating and abdominal discomfort, pelvic pain that worsens after using the bathroom or during intimacy. Let's go over some practical tips to help manage constipation. I want you to use a footstool or a squatty potty to lift your knees above your hips. Lean forward slightly and rest your elbows on your knees. Breathe out instead of straining. This posture strengthens the rectum and helps the pelvic floor release. About your nutrition and hydration, diet is one of the most powerful tools against constipation. But the key is gradual change. Fiber, start slow. Add fruits like pears, berries, or kiwi, vegetables like zucchini, carrots, and leafy greens, and whole grains. Too much fiber too quickly can cause bloating. Keep your body hydrated. Have sips of water every 10 to 15 minutes. And you know that hard stool is almost always linked to dehydration. Keep your body hydrated through the day. I want you to find your trigger foods. Processed foods, excess dairy, and high fat meals often make constipation worse. Eating at regular times helps trigger your natural bowel reflex after meals, especially after breakfast. Your bowel thrives on routine. Choose a calm, unhurried time, often after breakfast, to sit on the toilet. Over time, this trains your bowel to move more regularly and reduces urgency or retention. And also, doing some gentle clockwise belly massage following the path of your colon helps move a stool through and reduces bloating. Patients often do this lying down with knees bent before trying to go. You should know that constipation is not about weak pelvic floor muscles. It's about muscles that won't let go. Deep belly breathing teaches the pelvic floor to release instead of brace. One cue is, as you exhale, imagine your pelvic floor softening and melting downward. And perform some gentle stretches positions daily, like child's pose, happy baby, or lying on your back with knees side to side. Reduce pelvic tension and make bowel movements easier. Constipation worsens when you're stressed. Warm compresses on the belly, guided relaxation, or a short walk after meals can calm the nervous system and support bowel movements. One of my patients used to sit straining every morning for 20 minutes. Once she added more water, slowly increased fiber, used a stool on the toilet, and practiced belly breathing, she told me, "For the first time, I don't dread the bathroom. My pain is easing and I feel in control again." Constipation doesn't just make your belly uncomfortable, it keeps your pelvic floor in constant tension, creating pain. But with the right steps, nutrition, hydration, posture, routines, massage, and relaxation, you can break the cycle. If this video gave you useful strategies, make sure to subscribe, like, and turn on the notification bell for more pelvic health tips.